Yeah, hello. I am Dr. Varun Raju, Thirumalagiri. I am head of the department General Surgery, Minimal Access Surgery, and Bariatrics. We are more focused regarding the weight loss surgery from Omni Hospital. Yeah, past 2 years we have done quite a lot laparoscopic work and as well as general surgery, especially like a diaphragmatic hernia or a ventration. So we have done a very rare and procedure where we have done a mesh repair through laparoscopically. The left side of the diaphragm was totally deficient. It was just like a paper thin layer. So we have kept a mesh there. Definitely that comes as one of the rare surgeries which have been done in the surgical field, especially with the laparoscopy without opening the abdomen. For a bariatric surgery, usually the body mass index is one of the criteria where the surgery is going to be indicated. Like if the patient is having more than 40 BMI, is a typical candidate for the bariatric surgery. Or if the patient is more than 35 with a metabolic syndrome, in the sense a component of metabolic syndrome, like the patient may be having a sleep apnea, may be having a thyroid disorder, dyslipidemia, and osteoarthritis, cardiac issues, or the lung issues. So if these components are there, then if the patient is 35 with these components, we can definitely indicate a bariatric surgery. Yeah, there are different bariatric surgeries which are available to the obesity. The most commonly done surgery in India is the sleeve gastrectomy. Everybody have their own points to say that that may be one of the best bariatric procedure for the obesity. Every procedure has got the positive, the advantageous points and as well as the disadvantages. It depends upon the patient's condition, the patient's obesity, the patient's comorbid conditions, and how really you are defining the obesity. Is it a simple obesity, grade 1, 2, 3? I belongs to a group where the sleeve gastrectomy is one of the best procedure as an initial procedure even to the super obese patients. Why? Because you have to reduce the patient's weight to one certain level. After that we can modify the procedure to a bypass surgery. So the procedures which are available in bariatric surgery is divided like a restrictive surgery and malabsorption surgeries and modifications, combined surgeries. The most popular bariatric surgery is the sleeve gastrectomy. Yeah, actually obesity itself is a global problem. It is alarmingly increasing in numbers, statistics wise, due to the socialization and as well as the habits they have changed. And a lot of carbohydrates are being taken, a lot of energy is getting consumed. So they will become overweight. Of course, the family history, the genetical history and all other things may be there. But the most of the times it is because of the excessive intake of the energy, the calories. If you find out that if there is a food package or something like that which is artificially available, you can able to see that how many calories it contains. But many of the people, they don't see that. They don't see that. They just drink because it is tasteful. So they become overweight. So your question is it necessary for all the patients? No, it is not necessary. If it is overweight due to the diet, due to the excessive energy, we can always go for the diet modification with a dietitian and a physical trainer who is going to be set up to program individually about the patient to reduce the weight. These things should be tried first before going for the bariatric surgery.